Hi, I'm Babette Edgar, and I'm here today talking with Mitzi and Stan about the future of managed care pharmacy. How are you today?
I'm good. How are you?
Good, good. Can you tell us a little bit about where you work and what your job is and how long you've been a member?
I'm Mitzi Wasick, and I am the Director of Medicare Pharmacy Programs at Coventry Healthcare. And I've been there for about 2.5 years, first on the commercial side, now on the Medicare side. So I really focus on the quality, the STARS measures with Part D.
And how long have you been with AMCP?
I've been a member since 2000. My last year of pharmacy school, I joined when I took a rotation, and that motivated me to do a managed care residency, and then I've been involved ever since.
And you're on the board now, correct?
Currently on the board, serving my second year.
That's great. Well, thanks for your time today.
Thank you.
Stan?
I'm Stan Farrell, and I'm a Senior Clinical Director of Account Management with Express Scripts, and I've been with the PBM Express Scripts Medco for 6 years. Prior to that, I was with another PBM, Walgreens Health Initiatives, and prior to that, a career of about 15 years in the pharmaceutical industry. I started with AMCP in 1996 when I was a national account manager in the pharmaceutical industry. I had a boss who came from managed care to start a managed care department in a company and insisted that AMCP was the place to go and start back in that time. And since that time, through different positions and career steps, I've stayed a member of AMCP.
And you're currently on the board of directors, correct?
I am a new board member as of yesterday, and glad to serve.
Mitzi, you'll have to show them the way.
Yes, definitely.
Well, we're here today. We're talking a little bit about the future of managed care pharmacy and just getting some opinions of what you think it's going to look like in the next 5 or 10 years. So, thinking about all the change that's occurred in the past several years, where do you think managed care pharmacists will be practicing in the next 5 or 10 years?
Well, I think that's a great question, because the way we look at pharmacy now, we silo ourselves. You have clinical pharmacists, you have a managed care pharmacist, you have retail, you have hospital, and so on. But the one thing when I teach in the universities that I always ask, my first intro to the class is, who in here has practiced managed care? And nobody raises their hand. But then when you kind of go over what a managed care pharmacist does, by the end of the class, they get it. If they work in retail, they practice managed care. If they work in hospital, they practice managed care. So through AMCP, I think we need to do a better job of changing the perception of managed care and kind of the paradigm of what the model is. We need to do that better with our students, with our colleagues, with the public, to let them know that every aspect of pharmacy has managed care built into it, and to really highlight that. But I think looking at some up and coming emerging trends, we have ACOs, specialty pharmacy is taking on a life of its own, and that requires a lot of training, a lot of background as someone that understands the clinical effectiveness, looking at the studies. We've got biosimilars coming out, really looking at the cost, and at the end of the day, what is the best treatment for the right patient at the right time. And so we're going to have, instead of just all of our pharmacists in-house in the managed care organizations, they're going to be out in the hospitals, they're going to be in the clinics, in the ACOs, the medical homes, and it goes back to the grassroots of just teaching managed care to the students and having them bring that up through whatever their employer status happens to be.
Now, do you think the schools are teaching enough, the right things? I mean, do you think there could be more? Any thoughts around that?
Well, I spent 8 years in academia, so I did teach managed care, but you had to have someone that was promoting managed care from within, and that's really hard to find in academia. And, in their defense, ACPE is really hard to, get all of the accreditation standards fit into one curriculum in 4 years. So when you look at the therapeutic areas that you have to cover and everything else, it is hard to fit that in, but that's where AMCP has done a great job with the diplomats, with the student pharmacists, to kind of, bring those ideas up. There's an extreme amount of space out there still. I mean, we only have 55 or 56 chapters in the 110 plus schools out there now, but we need to kind of partner with them better and make it a requirement in the curriculum to, expose the students. Every student you see here, they have no idea what managed care is at some point when they enter AMCP, and then, after their 3 or 4 years as a student member, they come out, and it's just a whole new world that they wouldn't have gotten if they weren't part of AMCP, and we cultured that for them. Mm-hmm. So I think that's definitely an unmet need that we still have a lot of work to do.
Great. What are your thoughts on that, Stan?
About the future.
About the future
of
yes.
the managed care profession. I guess my first thought has always started with there's no such thing as unlimited resources. Mm-hmm. And additionally, I agree with Mitzi about the future, the trends that we see, and what that means to where the future will be. I think some of the recent changes as the government, as the largest health payer, has insisted and placed upon the healthcare system in the United States, would be a focal point that I see that will drive the future. And by that I mean there is, in a way, a forced integration of care now. Quality indicators, whether it's in Medicare Part D, that are aligned with payments, mm-hmm. Are now, and the ACOs, the Accountable Care Organization models, are going to finally have a requirement that everybody have an integrated or cooperative kind of approach. That means pharmacists are talking to nurse case managers, mm-hmm. are talking to doctors. And if a patient with diabetes or a population of patients with diabetes don't reach their outcomes, then the payer will reward or incentivize a good outcome with a population of patients and vice versa. So, financials, there's an alignment of incentives, mm-hmm. but across, different providers. With that, I think that requires, maybe some new skills for pharmacists. You actually have to have, I think, some knowledge of the payment methodologies mm-hmm.
Mm-hmm.
to have a discussion about an integrated care model. Mm-hmm. You have to know how the payment from the government comes to a health plan, how a member pays, and the cost share structures, the benefit designs. So there's a lot more, I think, than just the clinical aspects of understanding, for example, diabetes again, that is required of a pharmacist. There are different roles that a pharmacist will play now and in the future. Again, there's sort of a silo that there's pharmacists that are client-facing and supporting clinical initiatives of health plan clients. There are those that are reviewing data on new drugs coming to marketplace and have extremely good skills at looking at clinical data and developing monographs for pharmacy and therapeutic committees. But I think, if you have to have an integrated model, all those pharmacists have to talk. I don't think you'll have one pharmacist that can ever do it all. Mm-hmm. I know Mitzi's close to that, but you have to have a wide set of hats, or you have to wear a wide set of hats more and more, I think, to be a managed care pharmacist and be able to converse with pharmacists in different parts of the system. Mm-hmm. Not to mention doctors, case managers. I think some other skills, you have to have some data skills. So I don't necessarily think everybody has to be a Microsoft Access or a programmer for SQL or SAS, but I think data skills, and by that I mean taking data and turning it into information.
Mm-hmm. Actionable information.
That you can do something with. And so there's a lot of need to be able to think more globally, more holistically in an integrated system, I think. Academically, are we there? Based on some conversations I've had recently with some deans of School of Pharmacy out here in California, for example, I don't think they ever think the curriculum's perfect, but I think they see that there's an opportunity to look for opportunities for pharmacy students to see career choices that are outside of the more traditional retail or hospital pharmacy roles.
Mm-hmm. It's interesting what you said about pharmacists are going to have to talk and they're going to have to wear multiple hats. Do you think with all of the information now and all of the different roles that we play that you'll see some specialization within managed care?
I think so. the phrase specialty pharmacy, and that's got a lot of connotations, a lot of different definitions depending on who you talk to. I think it brings to light one of the challenges is to really serve a significant patient population in HIV, for example. You really have to know a lot about the total care of that patient, their cycle through the healthcare system, the total cost of care, and be able to communicate again in an integrated model fashion. So you won't have the same physician types. You'll have a different set of case managers and the like down through the system. And to be a pharmacist operating that environment, and then it's really hard for me to envision how you're going to turn that off and then go talk about a breast cancer specialty drug and then turn that off, and then, in the next hour or so, you're going to be talking about Lumazyme for a rare genetic disease, for example, for Pompe. So, to me, that's a form of the specialty pharmacy. Again, it's somewhat of a recent phenomenon, but again, talking about trends, there is strong evidence that shows this is going to be a large part of the pharmaceutical care model of the future. How are pharmacists going to be knowledgeable enough, and can they wear the hats to drive specific patient type discussions?
Mitzi, what do you think about that? I mean, dealing with Medicare, do you think that there needs to be specialized training in Medicare for a pharmacist to practice? And if so, what do you think that would look like?
It's tough to say in Medicare outside of having a law degree or reading Greek. That's
for sure.
Just kidding. But no, there's so much to learn that, avenues like AMCP, I think will turn into more of hands-on learning and training versus just informational. And when you look at provider status, what is that going to mean? Do you have to have a certain specialty to do that? So does a Medicare certificate or whatever it might be come into play when we talk about provider status? But I think everything is getting so complex, and it's going to be so important, like Stan said, to keep it a continuum to make sure everybody's talking to each other, that I don't want a certificate in Medicare, or I don't want to just be trained in Medicare, but I have to also kind of keep my specialty hat on just to kind of know what's going on. So I think we're right there trying to figure that out. I don't think there's an answer yet, and I wish I could see that far in the future. I mean, every 3 to 6 months, just in my job, the quality indicators change.
Right.
And you're constantly having to stay ahead of the game. So it'll be interesting to see what happens.
I would agree in that, it seems to be you have to get a new hat. I need a new hat to do my job. And to me so far, again, being a member of AMCP since 1996, I can depend on AMCP to help me figure out how to wear a new hat. So when it came to Medicare Part D and it being developed and implemented here in the United States, I feel 100% confident that this organization provided what the membership needed. It helped managed care pharmacists understand how to work in that new environment, just like the ACA, the Affordable Care Act, and what we have with healthcare exchanges that are right upon us as imminent. A lot of people are, flashing back to the 2004-5 time frame, but yet again, AMCP in this recent meeting has provided a lot of good content, and they have a lot of content that's flowing forth through their website and other parameters to get there. And I think, that speaks highly of this organization is tuned in to what's going on environmentally, and they talk to all the components of the healthcare system to bring the right content in. So
great. Well, thank you both for your time today. We really appreciate your insights.
You're welcome, Babette.
Thanks.